I'm going to show you how to attach a 5-lead telemetry electrode. We use those on the units for our patients. They are all should be color coded. So we have black, white, green, red, and then we have a brown. This one only has 4, but we do have a brown lead. If they're not labeled, the easy way to remember this is white is right, so white goes on the right, and then lower right is green, upper left is black, lower left is red. And the way I remember this is we have white is right, and then snow over grass, and then smoke over fire, and then your brown is your ground. Okay. As far as location goes, you want the mid-clavicle area just below that on the upper, and then the left side will mirror that. So mid-clavicle, right in the middle, right below it. The lower limb leads, you want to do lower rib area. So you can go out to the side, that's fine, but you want it on the lower rib. If you get too close in on the belly, on that soft tissue, then when the patient breathes, the monitor is going to be a real wavy waveform, and we don't want that. So out to the ribs. To prep the skin, we use an alcohol wipe. We just open it up and wipe down the skin to get off any excess oils or dead skin cells. You might have to clip some chest hair if you have a very hairy chest. Just check with the nurse's aide as to where those are located. If you have a patient who's allergic to the electrodes, then we do have pediatric ones that you could use. They have a little smaller surface area. I would check with the aides on that floor to find out where they keep those. Ideally, you want to change these electrodes every 24 hours because patients can be really sensitive to the adhesive and that electrode gel, and that can also dry out. So when we change them every 24, you want to alter the site. You don't want to always put it right on the exact same spot it was before. You want to move that site around. And for those of you who don't, who use alligator clips in your area, these just pop on. They're super easy. They pop on and pop off. If you're asked to go check electrodes on a patient, that means you go in, you look, make sure everything's connected where it's at. If you find one that maybe is lifted half up or on a gown or something, just change it. Don't try and re-stick it, just change it, because that electrode gel is not going to be as good as it should be. So that is our electrode placement. The next thing we're going to move on to is the ID wristbands. We have a lot of different colors that signify different alerts. Each one will have written on it what the wristband means. So the white is your patient identifier that you normally see. Red is allergy, whether it's to food, medicine, dust, whatever. Green is a latex allergy. So if you have a patient with a latex allergy, if they're getting a Foley catheter, you want to make sure you get the non-latex catheter. Use non-latex gloves, O2 tubing, things like that. The other one, pink limb alert. That's important to know that if a patient who's had like a mastectomy, or say they have a fistula in an arm because of dialysis, they get a pink limb alert on that affected side. So that means no blood draws, no blood pressures, no IV sticks on that affected side. You want to use the side that doesn't have the wristband on it. Purple is our do not resuscitate. It'll be written on there whether they're a complete DNR, where we let nature take its course, or a limited DNR, where we may do just CPR only, or medications, or mechanical ventilation. So the nurse should know what that is. And then lastly, our yellow wristband. It's important to know that our patients at a fall risk have a yellow wristband. So if you're getting them, you walk in the room and you get them up to the commode, you want to make sure you stay with them. They can be in the chair or they can be in the bed, but they can't be up moving about without assistance. So if you get that patient up to the commode and they say, "Oh honey, I'm good, you can go on." No, you have to stay with the patient. Don't leave them alone, because they will fall if they get up.